Hello everyone, I am Dr. Vikas Singhal, Associate Director, GI Bariatric Surgery at Medanta Medicity Hospital in Gurugram. So today I would like to discuss about robotic surgery and for which operations robotic technology has an advantage. Of course, you may have heard it is very common these days in news that robotic technology is there for most of the surgeries that we do nowadays. कई बारी मन में सवाल आता है कि क्या ये रोबोट ऑपरेशन करेगा, तो ऐसा नहीं है। ये एक एडवांस टेक्नोलॉजी है जो कि हम सर्जन्स यूज़ करते हैं पेशेंट के बेनिफिट के लिए, जहाँ पे कि विजन बेटर होता है, प्रिसीजन बेटर होता है, जिससे कि मूवमेंट्स बहुत फाइन हो जाते हैं। तो डेफिनेटली रोबोटिक टेक्नोलॉजी इज़ अ गुड टेक्नोलॉजी that we use in a lot of advanced surgical procedures that we do these days. Here, I want to discuss about when you should think of utilizing the robotic technology, because it tends to be a bit more expensive than the commonly done laparoscopic or open surgeries. For few surgeries in particular, such as hernia repair surgery, like incisional hernia, inguinal hernia, hiatus hernias, fundoplication surgeries, definitely robotic technology has an advantage. The reason is that because when you think about it, in hernia surgery we are operating at difficult angles. With normal laparoscopy, what happens is that because of the lack of space, laparoscopy tends sometimes to be difficult. But with the robotic technology, especially for hernia repairs, it gives us a lot of advantage, because even in a small space, the movements of the robot are much finer, much more precise. So what it means for a patient is that we can utilize the technology and often complete the surgery in a minimal access method and not having to open. So definitely for hernia repair, robotic technology can be a very good technology. Another such surgery is bariatric or metabolic surgery. Here what happens, because of the patient weight, sometimes we are operating patients heavier than 100 kilograms. It can be very difficult because the abdominal wall can be quite thick. So the normal laparoscopic has a limitation, and sometimes it can be difficult to lift the whole heavy abdominal wall. So that is where the robotic technology gives us a lot of good advantage, because the movements of that we do on the robotic console are stimulated inside the patient. The same movements are done. So even though space is less, the wall is very thick, we can achieve a lot of precision in even these difficult abdominal walls also. So this, I hope, will give you some idea why robotic technology tends to be preferred, has advantages in some surgeries like hernia surgery, bariatric and metabolic surgery, and of course it is done in a lot of other GI cancer surgeries, colorectal, esophagus, the food pipe surgery, where definitely the technology has a lot of advantages. So I've tried to explain to you why robotic technology has advantages in particular surgeries, such as the hernia surgery and bariatric and metabolic surgery, and of course a lot of cancer oncology surgeries are done with the help of robotic technology. But I would say ultimately, if you are considering surgery, especially if you are considering the robotic technology, feel free to discuss it openly with your doctor, so they can guide you appropriately where robotic technology would have an advantage. Thank you.